Hi, I'm Sukin Shah, President of the Setting Scoliosis Straight Foundation, and I'm pleased to welcome you with all of our panelists today to the Patient to Patients webinar in honor of June, which is Scoliosis Awareness Month. This webinar is sponsored by the Setting Scoliosis Straight Foundation and is really designed to give you the best evidence from a peer-to-peer aspect about scoliosis and perhaps to educate you and other people in your family about this condition. If you think about a condition such as scoliosis, which affects 2 to 3% of the population, that's about 10 million people in just our country alone. Scoliosis affects teenagers, adults, and even the elderly folks, much to the same extent, but in different ways. Today, we'll be joined by several panelists who will give you a glimpse as to how they dealt with their condition, their path moving forward, and it's really about giving you hope that you are not alone with your condition. I'm pleased to be joined by Dr. Nick Fletcher from Children's Healthcare of Atlanta. He's a spinal surgeon and also a member of the Harm Study Group, which is a group of surgeons whose mission and passion it is to do research with patients who have scoliosis and other spinal problems in a way to improve their outcomes and make innovation more accepting and safe for patients. We'll be joined by several panelists tonight: Miranda, Brooke, Ava, Michelle, Kathryn, Amar, and Piper. And what they all have in common is that they have scoliosis, but they may be being treated in different ways, and you'll get to see the comparisons in different modes of treatment. We have some housekeeping instructions. Please submit your questions through the Q&A, not through the chat section. We'll get to as many questions as we can live. Those questions which we can't get to live, we'll try to answer online simultaneously. So first, we'll have a brief talk by Dr. Fletcher on what is scoliosis, or Scoliosis 101. Then we'll hear from Miranda and Brooke, Michelle and Kathryn, Ava and Amar, who will present patient stories along with Piper, and then some concluding remarks. We'll be joined by Michelle Marks, who's the executive director of our foundation. Setting Scoliosis Straight is a nonprofit organization whose mission is to better discoveries and advanced techniques in the treatment of scoliosis in children and adolescents worldwide. We interface with many different medical centers and surgeons throughout the world as well. We have a vision of a future where children with scoliosis have the ability to live happy, healthy, and productive lives, and you'll hear from many of them during this webinar. Pleased to introduce my friend and colleague, Nick Fletcher from Atlanta, to tell us about Scoliosis 101. Nick?
Thanks, Sukin. I appreciate the introduction, and I appreciate all of the attendees as well as our speakers tonight. This is going to be a very brief overview about scoliosis. Obviously, many people who are on this webinar probably have it, and I think we're probably all affected by it in some way. Scoliosis is something that occurs when there are changes to the normal anatomy of the spine. Obviously, the normal anatomic spinal alignment is straight from the upper neck region all the way down to the pelvis, and the vertebrae are sort of stacked on top of each other in a very predictable fashion. In the situation where we see spinal curvature, this alignment changes, and so the spine rotates, curves, and twists, and that's what creates scoliosis. There are a lot of varieties of scoliosis, a lot of causes and shapes, and at the end of the day, in many situations, we don't actually know the underlying cause. What a lot of times we see in teenagers are changes to body shapes, and these are oftentimes the things that are picked up by parents or care providers or even school nurses. And these are such things as asymmetry to the shoulder, where one shoulder looks higher than the other, changes to the way that the waist looks with a crease. In women and girls, there can be changes in their chest. The rib can become prominent. And then looking at children from the side, you can see that the mid area of the back actually flattens out. As the spine rotates and twists, we actually see changes to the ribs. And so this is probably the most notable difference that can be picked up and is related to the actual twisting and curving of the spine. This whole area is very important for us to think about because of the fact that the spine and ribs contain the lungs and heart. And the lungs are important for breathing. The heart obviously pumps blood through the system. And while mild scoliosis really has no impact on these, severe scoliosis can. It can affect things like breathing. And so management of scoliosis in a way that can prevent long-term problems with as it relates to lung function and breathing is really important. As Dr. Shah mentioned, about 3% of healthy teens have scoliosis, and typically these are picked up in the growth spurt, which is why oftentimes school systems will screen for this. And certainly where I live in Georgia, this is a state mandate, but it can still sometimes go unnoticed. What we find is that for smaller curves, like this curve on the left, the ratio of boys to girls is about equal. And this happens in about 3 out of every 100 children. For the larger curve, as seen on the right, this is much less common, maybe 1 in 5,000, and girls are much more likely to have that. And so if you look at our group of panelists today, that ratio is somewhat maintained here. Scoliosis can also occur in many other conditions, such as cerebral palsy, conditions such as neurofibromatosis, and children can even be born with it, what we call congenital scoliosis, where the vertebrae aren't formed in a normal way. And these occur with variable rates depending on the underlying condition. So thank you for your interest today, and I'm going to go and introduce our first speakers. I can forward this along. So our first speakers today will be Miranda and Brooke from the Saving Spines Foundation. Take it away, ladies.
Hi, I'm Miranda Novelli, and I'm a scoliosis observation patient. In 2018, I went in for my annual checkup when my doctor noticed an abnormal curve in my spine. I went to go get it checked out, and after taking x-rays, they confirmed that I do have scoliosis. They said we didn't need to take action because it wasn't at the point where I would need a brace or surgery, but they wanted me to keep coming in biannually to make sure it wouldn't progress. As I was growing, I started noticing that my right shoulder blade would stick out, and this made me very self-conscious, so I would wear hoodies constantly, and if I was wearing anything a little revealing, I would make sure that if I was taking pictures, that side of my body would be hidden. So I chose these pictures because on the one on the right, you could see I'm kind of hiding behind my friend, and then the one in the middle is just how my shoulder blade would stick out. A while after I was diagnosed, I began going to the gym. I quickly realized that while working out, I would have back pain doing certain exercises. This would feel very uncomfortable. This was also very frustrating for me because something that is quite simple for other people is kind of a challenge for me. However, I didn't let the discomfort stop or slow me down. I researched many workouts and tried different things to see what felt good and work the muscles I was targeting. I've been going to the gym for about 1.5 years now, and I feel great. I've learned to modify my workouts around my scoliosis so that way I could get through my workouts without having back pain. My confidence has definitely gotten a lot better throughout the years, and I've learned to love my body. I chose these pictures because a few years ago, I would never pose like this for any pictures showing the side of my body, especially my right side or my back. So I just really love these pictures. And I feel like it's really important for me to share my story with scoliosis because sometimes I feel like my story is not worth sharing since I'm only an observation patient. However, I know that there are other young people who may be feeling the same way, and it's important for them to know that they're not alone and that their feelings are valid. So hi, my name is Brooke Martin, and I was diagnosed with scoliosis when I was 10 years old. I underwent all the typical treatment, the bracing, the physical therapy, the doctor's appointments, the works. And despite all this, I got my scoliosis surgery when I was 13 years old. I'm now 17 years old, and I'm happier and healthier than ever. So as you can see in this slide, I'm doing physical therapy such as Schroth. You can see me in the hospital after my surgery, and you can see a before and after x-ray of my spine. So after recovery, so before my scoliosis surgery, I was a volleyball player. And as many of you may know, when you undergo spinal fusion, you can't play sports for about 1 year. So I quit. I act like I was forced to quit, but in reality, it was a relief. Having scoliosis sparked some insecurities regarding my athletic abilities. Nobody else on my teams had to wear a back brace for 16 hours a day or go to physical therapy every Tuesday. It was just me. For a preteen girl, being different can be nauseating. So as you see in these pictures, I'm playing volleyball from a very young age with a lot of different teams. After recovery, I realized scoliosis was only a weakness if I allowed it to be. Instead, I could view my scoliosis as fuel. I always considered myself mentally strong, but now I let my scoliosis fuel a new form of strength, physical strength. So I started going to the gym. Over time, I gained lots of muscle, improved my agility and my flexibility, and I felt so much more confident overall. So these are some pictures of me working on my physical health and just becoming more confident in who I was. And I wanted to put this newfound strength to use. So last year, I tried out for the volleyball team at my school. Joining the volleyball team was one of the best decisions I've ever made. I was terrified walking onto that court for the first time in 3 years, but I can honestly say my life has not been the same since I did. I was a much more confident and athletic player than I used to be, and with a team that valued me and a coach that truly inspired me, I realized how much fun volleyball was. At the end of the season, I was surprisingly sad. I never expected to have so much fun, and I knew I was going to miss the sport until next season. Then I got a phone call. An old coach offered me a walk-on position on a national team at my old volleyball club, and I said yes. I've been able to travel around the country with a group of really amazing girls and compete in the sport that I love. Anytime I walk into the gym or onto the court, I'm reminded that my scoliosis is just a symbol of my strength. So after my surgery, my doctor asked me if I wanted to talk to other girls with scoliosis and share my story, and I said no. I was uncomfortable sharing about something that had brought me so much embarrassment and pain. I wanted to pretend like I never had scoliosis and simply just get on with my life. As you can probably tell just by me speaking to you now, that has changed. As I recovered and time went on, I learned it's never that easy. I could spend the rest of my life trying to hide my scars, both physically and mentally, or I could be proud of what I overcame and help others overcome similar battles. This is when I decided to start my own nonprofit, Saving Spines. Saving Spines is a nonprofit organization dedicated to helping other scoliosis patients and their families. Being the founder of and president of an organization that stands for something I so strongly believe in is one of my proudest accomplishments. The knowledge and growth that I have gained from my experiences were only worthwhile if I put them to use in a beneficial way. As you can see here, I'm just enjoying my life and really just making the most out of where I am and how far I've come. Making a difference shows me how far I've come and how far I can go. The desire to improve and persevere has made me stronger than I ever realized I could be. Over the last 7 years, scoliosis has helped me become a person I'm proud to be. So let's talk a little bit about our nonprofit, Saving Spines. As briefly mentioned before, Saving Spines is a nonprofit organization created to raise awareness and money for scoliosis patients, research, and treatment. Our goal is to provide financial and emotional relief for scoliosis patients by working with other scoliosis-centered nonprofits and organizations, as well as creating fundraisers to spread our message. We were founded in January of this year with the goal of raising $10,000. We were so excited when we got the opportunity to work with Setting Scoliosis Straight. We think that their message is truly inspiring, and we knew that as a new organization, one of the best ways we could put ourselves out there and make a bigger difference was by collaborating with a larger organization such as Setting Scoliosis Straight. We actually just finished our biggest fundraiser so far. We had a car wash on last Sunday, June 25th, where we were able to get our friends to wash cars, and not only was it super successful, but we had so much fun. Even if you think what you're doing is minuscule, it makes a difference. It's extremely rewarding aiding a cause that you feel passionate about. Yeah, I get to work with my best friend and do something that I take a lot of pride in and that helps others. And after the car wash, we were able to raise 3 times our projected amount from the car wash, which is just really rewarding. Please follow us on Instagram at Saving Spines and check out the website that's in our bio. We appreciate each and every one of you, and thank you so much for listening to our story. If there's one message that I could give other kids going through a similar battle, it's to be confident. Don't let a brace or a scar stop you from reaching your goals. We're proud of you, your friends and family are proud of you, and you should be proud of yourself. If you ever need anything, whether it's support or advice or just something else, feel free to DM us.
Great. That was fantastic, ladies. And I have to say that Miranda, being part of an observation group makes you actually the most common form of treatment for scoliosis, because the vast majority of people who have small curves don't in fact progress. So that brings us to our first question by Suzanne. Can the patients please mention the degree of their curvatures especially Miranda, who's being treated with observation. Thank you.
So my degree, I have 20 degrees on the top and 18 degrees on the bottom. And before my surgery, I have an S also, and I was like about 50 and 50. I don't know the exact, but I think I'm somewhere like at 15 and 15 now after my surgery.
Perfect. And that's about right for both groups. I would say that most curves that are small, certainly under 20 degrees, can be treated with observation. If we see progression, there might be an opportunity to brace somebody if they're appropriate. And we reserve surgery for the most severe types of curves, such as Dr. Fletcher mentioned, and some of our later panelists know, at about 50 degrees would usually be the threshold for most people to have surgery. Brooke, I was inspired by your pursuit of exercise and going back to volleyball. And in recent years, we have gotten much more, I would say, aggressive about getting patients back to school, back to sports. Dr. Fletcher has led a lot of this effort in decreasing the days in hospital and allowing recovery to happen at home. And so Nick, what can you tell us about return to activities in 2023, specifically non-collision sports? What do you tell your patients?
Yeah, it's interesting. I think that that's changed over time, and a great question, because I know that it was mentioned that the time out of sports is a year. Oftentimes nowadays, we're recommending that patients go back to most non-collision sports basically when they feel up to it, which on average is around 3 to 4 months in some more recent studies. And so there are certainly athletic endeavors, collision sports like football, which I think some of us are still somewhat apprehensive about. But for the majority of my patients, I tell them 3 or 4 months and they can go back. And then for patients who are into lower contact activities, for example, running, basically whenever you're ready. And I've had patients go for jogs 3 or 4 weeks post-operatively, just very short ones. But I think that the strength of the implants that we place these days allow us to really get kids back pretty quickly.
Great. And Miranda and Brooke, thank you so much for setting up that nonprofit. What would you say was one thing that you didn't expect to happen that happened as you two set out on this journey?
I would say one thing we didn't expect is to be able to participate in webinars such as these. Although we were thinking we were going to make a difference with things such as fundraisers and that, I think we really are grateful that we got the opportunity to be able to like speak directly to other people, because originally I don't think we had that in mind.
Wonderful. Well, you guys are great ambassadors.
So
well, in the interest of moving along, I'd like to introduce Michelle and Kathryn, who are going to tell us about the EA Disorder Awareness Club.
Awesome. Okay, so I'll share my screen. All right. Hopefully you can see that. All right, perfect. All right, then I'll pass it to Michelle to introduce us.
Hey everyone, I'm Michelle and this is Kathryn, and we co-founded the Disorder Awareness Club at our School Episcopal Academy.
And so our agenda for this presentation, so Michelle is going to share her story. I'm going to talk about mine, and then we're going to get into how we founded the club and some of the things our club has done. And then I'll pass it back to Michelle.
So I'm currently a rising senior at the Episcopal Academy, and I play tennis, I play violin, and also love traveling. So I was diagnosed with adolescent idiopathic scoliosis at age 12, around in 7th grade. And I remember it was when my dad noticed like a slant on my right shoulder. And initially we thought it was from playing tennis. So we thought my right side was more developed than my left. But later my pediatrician told me to get an x-ray taken, and we discovered that I had about a 35-degree angle S curve on the top and bottom. And so I was treated with a Wilmington brace, which I had to wear from about 14 to 16 hours a day. So I didn't have to wear it during the day or at school, but I did have to wear it at night. And that lasted for about a year and a half. And thankfully, both my curves were stabilized around 35 degrees, so they didn't progress or decrease or anything. So I just remember initially wearing my brace was extremely uncomfortable. It was really hard to motivate myself to wear my brace every single day or every single night. And I knew that, or whenever I took off my brace at first, I would have red spots in the parts that like the brace pushes in. And so to combat that, like my mom, she got like these different creams, and I tried different shirts underneath my brace to make it feel better. So like as time went on, I got more used to the brace, and I continued to play tennis. It didn't affect my life way too much, but initially it was really hard to like stay on track. So like one of the biggest things I found that was really, really helpful was just to talk to other people that who also had scoliosis. So like at my school, I found like a few girls that like also had scoliosis, and talking to them made me feel a lot more comfortable, and hence why I eventually started the Disorder Awareness Club at our school.
All right, amazing, Michelle. And then a little bit about me. I just graduated from the Episcopal Academy with Michelle, and then this fall I'm studying art, tech, and business in college. And I love the outdoors and hiking and just being active. So my diagnosis, right before 7th grade, when I went to the pediatrician, she noticed that my shoulders were a little uneven. And then I went to, she referred me to Shriners Hospital in Philadelphia. And so there they took my x-ray, and then I had two 27-degree curves, which you can see in the picture on the bottom right. And so it's considered an S curve because I have one going one way and then another going the other way. And so my treatment was a Boston brace, which I wore for about 2 years. So up until the start of my freshman year of high school. And I wore it for 22 hours a day, and I was pretty committed to it. I normally like didn't stray from this 22 hours. I was tried to be really, really dedicated. And so my experience was, I'm going to echo a lot of what Michelle said. I think it was initially definitely a little uncomfortable and maybe kind of hard to get used to, but I think it definitely did. And, you know, you find like comfy t-shirts to wear, and like, and yeah, over time, it definitely gets a lot better. And yeah, ultimately bracing worked. My curve was stabilized at around that. Like, I think my last x-ray was this, like maybe about a month ago, and it was around like 29 degrees, which is like give or take, you know, a few. So that was great. And yeah, my advice is going to be find community and connect with others. It's so nice to have someone to talk about it with. Like Michelle and I talk about it all the time. We love having this club, having a safe space to talk about it. So that's a really important piece of advice, I think. And then I'm going to pass it to Michelle to talk a little bit more about our club at our school.
Yeah, so just like what Kat said, we're going to talk about how we started Disorder Awareness Club, what our club has accomplished, and just our future plans. So our club's mission is to provide education and raise awareness for all disorders, but we mainly focus on scoliosis.
And so here are a few of the reasons when Michelle and I initially started our club, what we wanted to focus on. So the first one was raising awareness. So we made an Instagram page where we could post, you know, club updates or like informational slides to educate people who follow it, because we believe that knowledge can lead to action. And then the second component was education. So we our school is K through 12. So we visited our middle school to give a presentation about various disorders, including scoliosis, especially because its early detection is so important. We thought that it's good to like get that knowledge out there, especially towards younger audiences. And then this summer, we're going to be speaking with Horizons, which is an organization from Philadelphia. And Michelle will talk about that more in our future plan slide. And then lastly, something that was really important to both of us was finding that community, bringing people together to share stories and create a safe space where people feel comfortable talking about their conditions. And then I'm going to go to Michelle for future plans.
So some of our future plans include, of course, participating in more webinars such as these, like to raise awareness and also like educate other people about like what scoliosis is. Because I know when I initially was diagnosed, I had no idea what it was. We're hoping to do more fundraising events. I know there's a fundraiser that like goes along with this webinar. So yeah, just continue doing more of those and helping support scoliosis research. And what Kat mentioned earlier, we're also hoping to present to an organization called Horizons. So every summer at EA, we have students coming from schools in Philadelphia that are more like underprivileged, have less educational opportunities, come to Episcopal Academy and get a chance to just have like better education than they do during the school year. So we're hoping to make presentations to them in the summer. And so just to let them know about what scoliosis is, or what other disorders are, as they don't have as much access to medical information as the general public do. And we're also going to continue to make educational infographics for our social media. So if you check out our Instagram page, we have something set up for June Scoliosis Awareness Month, like what are 3 things that you can do. So we're going to continue making those. Those are really accessible to anybody who has social media. And just to end this, we're also hoping to inspire like other schools around us, other areas around us to start disorder awareness clubs, or just to promote scoliosis information to anybody.
All right, yeah, and then just to conclude, we have our Instagram handle if you want to follow our journey. It's at EA_DAC. And yeah, that concludes our presentation. Thank you so much for listening. Michelle and I really appreciate it.
Well, Michelle, Kathryn, both wonderful stories. Thank you for sharing and for all the work that you're doing. I think that the DAC sounds like a pretty terrific organization. I have a couple of questions, and we'll start with Michelle. So you mentioned the fact that you like to play tennis, and obviously where you live in the summer, probably playing tennis is nice. And I'm sort of curious how you balanced in the summertime your brace wear with the activities that you love to do, because I think at the end of the day, we're trying to lead as normal a life as we can in the setting of managing your scoliosis with a brace. Can you talk a little bit about that?
Yeah, so in the summer, in the past, I played a lot. Like I went to camps, I went to like training sessions, and that would last pretty much throughout the day. And since I was lucky, I only had to wear my brace 14 to 16 hours a day. I mainly had to wear it at night. So normally after like my tennis sessions, I would go home, take a shower, and then I would try to put my brace on for as long as possible. And that normally covered my hours. Yeah, so I was pretty fortunate. I was able to wear my brace in the allotted time and prevent it from progressing. And I still got to continue with my training. And yeah.
That's great. And Kat, sort of along a similar line, you wore your brace more, right? So you were a 22-hour a day wearer, which is terrific compliance. It's oftentimes challenging, I think, for kids at the beginning to get used to the prospect of being around others with the brace. What were some of the strategies that you imparted early on? And, during those periods where you're like, I'm just not going to wear this anymore, I'm going to, I'm over it. What were some of the ways that you got around that so that you could stay with it and really get to the point where you are now, where your curve is controlled and you're out of a brace?
Yeah, definitely. I think some things that help is that my friends were all like really supportive too about it. So I never like had to like hide it, or I never felt like I had to like wear super big clothes or anything over it. And I didn't mind like if someone like saw it or something. So I think that was something that was really important. And yeah, with 22 hours a day, I think just like staying committed, like I always used to think of it as like keeping like a streak going. Like I've been so dedicated, like I didn't want to give up on like how much hard work I had put in, especially because kind of right out of the gate, I was like, I really wanted to try and avoid surgery if possible. So I just kind of started out at that like kind of 22 hours right away. And then I was like, I just want something I want to stick to. And I just kind of made a commitment to myself to try and keep with it. And I think the longer it went on that I've been doing 22 hours, I was like, I don't know, I just felt like a responsibility to myself to kind of keep it going. So that's kind of how I did it.
That's terrific. I'm going to ask a question of Dr. Shah as well. Sukin, obviously this comes up a bit as we see patients and take care of our patients. Can you talk a little bit maybe about sort of current strategies and maybe future strategies for helping to reinforce the benefits of the brace as we move forward into, even more the digital age, if you will?
Sure. Well, it sounds like Michelle and Kat we're very responsible and very compliant, but that's not always the case. I think family support is very important. Support of your peers is very important, and they touched on various aspects of this. I think spending time in clinic, educating people about what the brace is supposed to do and what it may not be able to do, the dose-dependent response, that means the more you wear it, the better it works, the better you are able to perhaps avoid surgery. But now we have technology at our fingertips with compliance meters, perhaps apps that will communicate with your phone, remind you to put the brace on, tension the straps in the proper way, and just be a little bit more holistic with our approach to bracing, allowing specific activities to be permissible maybe not having to be in the brace all the time, but picking and choosing some of those hours based on customized treatment, curve type, skeletal maturity, size, and what our goals are.
That's great. So there was a question that I'm going to answer live from an anonymous attendee, that which for bracing patients, how do you know when to stop wearing it? So I'm going to take that as, when do we stop the brace altogether? And I'd say that that's dependent really in a lot of different situations, but this includes level of maturity, curve size, so how big the curve is, patient tolerance of wearing the brace, amongst another number of factors. So it truly is personalized medicine, and every child gets their own sort of start and stop time, and there are a lot of factors that go into it. So I think go ahead, Sukin.
Nick, is age. You would agree, we have much better ways of assessing skeletal maturity. And so we probably don't brace people for as long as perhaps our parents' generation was braced, because we just didn't know a lot about maturation. We're much more accurate about determining skeletal maturity now.
Absolutely. Well, for the sake of time, we're going to move on to introduce Ava, who is going to tell us about her journey with spinal fusion and also her experience with Embraced. Ava, take it away.
Okay. Hi, I'm Ava, and today I'll be talking about my journey with scoliosis. So when I was 9, I was diagnosed with scoliosis, and then when I was 11, I was prescribed to wear a back brace. So here are some real images of scoliosis back braces. And I remember going with my mom to the orthopedist office to get fitted for a brace for the first time. And when I saw what a brace looked like and what the designs on them looked like, I was honestly pretty horrified. The designs were pretty loud and garish and unflattering, and I was entering my first year of middle school. And, you know, being a tween, I was already very insecure about my self-image, and having to wear a brace on top of that was really difficult for me. So I actually couldn't even choose a brace design when they showed me the catalog of designs, and my mom ended up choosing one for me. So I ended up not wearing my brace for the prescribed duration, unlike Kat and Michelle, because I was just very embarrassed to be seen with it on. And as a result, my scoliosis continued to progress and worsen to the point where a few years later, I actually needed spinal fusion surgery. So the summer before junior year, I had surgery in my lower back, and the surgery impacted my life in so many positive ways, and I'm so grateful for having it. But I remember thinking during the recovery process, oh, if I only had worn my brace for the prescribed duration, you know, maybe I could have avoided all of this. And I actually joined a support group for other women with scoliosis called Curvy Girls. And that's when I learned that I was not alone. You know, many young women are embarrassed to be seen with a brace on, and as a result aren't really wearing their brace for the prescribed duration, which is leading their scoliosis to progress. And, you know, a few other girls like me ended up having to get the surgery. So during this time, while I was in recovery, I decided to start my own project called Embrace, which was a nationwide pattern design competition aiming to beautify back braces and make them more fashionable. So artists across the country, or essentially anyone, could submit a pattern that they think would be suitable for the surface of back braces. And then I partnered with an orthopedic company to transfer those winning designs onto the braces. So my goal for this competition was just around 50 entries, and Embrace actually received over 700. So it was really incredible to see, you know, the amount of people who were invested in this mission. And, you know, setting scoliosis straight was great because they really helped me market this competition and really get the word out there. And it was great to have, because our judges for this competition were actually women with scoliosis and women who wore braces. So it was essentially giving women a voice in that brace design process. And I was able to raise over $5,000 in cash prizes for the artists. And right now we're working on transferring those designs onto the braces. So here are a few samples. It's a very, very long production process. but it's just really exciting to see this project come to life and see, braces that like real girls are going to be able to wear, or patients are going to be able to wear. So yeah, this was a project that I'm really excited about, and I'm hoping to continue it later on. Something else I wanted to talk about was during my recovery process, something that really helped me get through it was art. I'm an artist, and during this time, I made a lot of art pieces that kind of communicated my journey with it, with scoliosis. And I also launched an art gallery exhibit called 43 Degrees, which kind of just showed my journey with scoliosis and a few different pieces. To raise awareness and also to empower other patients. I tried to make each piece kind of like a positive piece. And so I feel like now I'm definitely in a really great space since having the surgery. I just graduated high school and I'm going to my dream school, which is the University of Michigan. And I think if I could go back and not have scoliosis at all, and honestly, and like never have this happen to me, I wouldn't do it, because I think having scoliosis and going through this journey made me really understand like my identity as an entrepreneur, as a woman, and just has made me a lot more confident as a person and helped me realize what I'm passionate about. Like, I know I'm passionate about helping other people with scoliosis, and this is something I want to continue. So yeah, and I just want to say thank you to Setting Scoliosis Straight, because they really helped support me a lot with all my projects. And I'm so happy that I can be here and speak about my experience if it helps anyone else. So yeah.
Well, bravo, Ava. That was wonderful. That's quite a venture. And I wish you all the well in your entrepreneurship. When you do get these patterns on the braces, how do you, so you said you partner with an orthopedic company to market the braces. How do they make your designs stand out among those that are in that catalog, which you didn't find very appealing in the first place? Is it a separate book, or how do they feature your designs?
Yeah, that's a great question. So the goal of the Embrace competition was just to make the designs a lot more aesthetically pleasing. And we had real pattern designers submit braces or brace designs for them. So yeah, like right now, where it's a very long process of launching the designs, but so far when a design will go up onto like the Frittles website, it'll normally say like Embrace and then the artist who created it. So yeah.
And are there any braces with inspiring messages like I have on my Lululemon bag?
Well, that's actually another project I wanted to do, was to, a lot of fashion brands are starting to put QR codes on, clothing. So I wanted to do a QR code project where you could scan the QR code and that would lead you to the Embrace website, but also, to put an inspiring message on there too. So that's actually something I'm like kind of in the process of working on, but yeah.
Good. Well, we'll chat offline. All right. We'll move on to our next speaker. And remember, we'd love for you to submit your questions through the Q&A section during this webinar. I'd like to introduce Amar, who's a spinal fusion patient. Amar, can you share your slides?
All right. Can everyone see my screen?
You're good.
Okay, perfect. All right, so hello everyone. My name is Amar Hamad, and I'm here to tell you about my journey with adolescent idiopathic scoliosis. So my journey with adolescent idiopathic scoliosis began in 2016 when I was 13 years old, when my primary care physician noticed when I bent down to touch my toes, my ribs were tilted. And I also had a little bit of shoulder asymmetry while I was standing. Soon after, I was recommended to go visit an orthopedic surgeon and get x-rays. And when I got those x-rays, they indeed showed an S-curve with the lumbar curve measuring 14 degrees. At the time, I didn't really think of anything about my diagnosis because it wasn't too noticeable and it didn't affect my quality of life. I later moved to San Diego, California, and began seeing Dr. Peter Newton at Rady's Children's Hospital for yearly follow-ups. With every yearly follow-up, my curve grew steadily. I became increasingly frustrated with my curve progressing as I constantly stayed active by training year-round for spring track season, where I ran hurdles and relay races. We were eventually told that bracing wouldn't be an option for me since I had already reached skeletal maturity and that I would need to get surgery eventually. My family and I decided to get my spinal fusion during my spring break of my senior year of high school, since the recovery would be easier the younger I was. So my surgery day was April 5th, 2021, and I was 17 years old. The weekend before my surgery, I called my friend from track and field who also had a spinal fusion a few months before, and she was very transparent with me about her surgery experience and her recovery process. And it was incredibly comforting and reassuring to know that I wasn't alone. Because of that phone call, I walked into the hospital feeling incredibly confident and ready to conquer my journey to recovery. After my spinal fusion, my curve decreased from 51 degrees to 10 degrees. My dad told me that the first thing I did after I woke up from surgery was I asked the nurse to see my x-rays. And once I saw my x-rays, my dad said that he could tell how relieved I was when I saw my new back. So here are a few pictures of me in the hospital. And I had an incredibly positive experience in the hospital. My nurses and physical therapists were understanding, patient, and supportive. And this worked to boost my confidence when I started moving and walking 24 hours after surgery. Dr. Newton, he even came a couple of times to check in on me and my parents to see if I was doing well, which I appreciated a lot. My extended family from all over the country would DoorDash food to us while we were in the hospital, and my friends from school sent supportive text messages and sent flowers and balloons to my hospital room. I felt empowered knowing that I had so many people supporting my journey to recovery. My recovery at home was a difficult test of my mental fortitude, but my confidence began to grow as I slowly began to regain my autonomy by doing several progressively harder tasks every day, like watering the plants, like you see on the picture on the left. There were some days where I had setbacks where my back was more sore than the previous days, but my confidence was sustained by my support system of my family and friends that I had mentioned already. So 3 weeks post-op, I celebrated my birthday and I picked radish plants that I had planted before my surgery and maintained while I was recovering. 8 weeks post-op, I was well enough to return to school to finish out my senior year, and I walked across the graduation stage. 4 months later, I moved 500 miles away and I started my freshman year of college at Arizona State University. Now, it's been over 2 years since I've received my spinal fusion surgery, and I'm doing better than ever. Currently, I'm in between my sophomore and junior years of college pursuing, I'm studying biology and business, and I'm working as a dental assistant and a tour guide for my college. I'm also more active than I was before my spinal fusion surgery, and although I don't run track anymore, I frequently play tennis with my family, and I just returned from a ski trip a couple of weeks ago. So all of that being said, I must acknowledge that my spinal fusion journey wouldn't be as positive as it was if it weren't for my support system of friends, family, doctors, and nurses. I'm now an ambassador for Setting Scoliosis Straight, so I can hopefully be a part of your support system too, no matter where you are in your scoliosis journey. I attached my email if any of you would like to contact me with questions and or schedule a phone call with me like my friend did to me before my spinal fusion surgery, and I would love to pay it forward that way. I also attached a link to an article that I wrote describing the nature of my diagnosis, my surgery, and my recovery time more in depth than in this presentation. You can also visit the Setting Scoliosis Straight website to find numerous patient stories. There's so many of them that I read while I was preparing for my surgery. I can't emphasize enough how beneficial it is for me to be able to talk to a friend before my surgery, and she was able to coach and support me through it all. So thank you so much for coming to this webinar and listening to my presentation. And at the end, I hope you leave feeling empowered and knowing that you are not alone in your scoliosis journey.
Amar, that's quite the story, and kudos to you for keeping such a great positive outlook on it throughout it. I always ask my patients when they're a couple of years out how often they think about their back, and how often is it remind them that they had surgery, or do you on a regular basis just sort of you've gotten used to the change that happened and it never really comes up?
Yeah, that's a great question. So, yeah, as I said before, I'm 2 years post-op. And to be completely honest, I rarely think of my back at all. Yeah, a common side effect or a side effect with all spinal fusion procedures is that you lose a little bit of mobility. But to be completely honest, I have not noticed that at all. And I, I am pretty comfortable saying that my quality of life is even better than it was even before surgery. I don't really notice it at all, which is pretty amazing.
That's terrific. Well, really great story. And for the sake of time, we're going to have to move on, but thank you so much, Amar. And we're going to finish up on our patient stories with Piper, who is was treated with a different type of surgical management, vertebral body tethering, actually by Dr. Shah. And so Piper, tell us your story.
Okay. Hi everyone. I'm Piper. I'm 12 years old. I live in Pennsylvania and I have idiopathic progressive infantile scoliosis. I was diagnosed at just 18 months old during one of my GI x-rays. However, I didn't begin treatment until I was 3 years old. This was because my pediatrician at the time didn't understand that large curves in babies needed treatment. He would keep an eye on me until I was 12 or 13, and then refer me to an orthopedic surgeon as he did for his teenage patients. My story is a little different from the others because I can't remember living life without scoliosis. When I think back, for as long as I can remember, Dr. Shaw, back braces, and road trips to the hospitals have always been part of my life. I can't tell you what I used to be able to do versus what I could do now, because I can do anything I set out to do. I enjoy playing soccer, lacrosse, and field hockey. I've always enjoyed running, and recently I started running between 2 to 4 miles on summer break to remain healthy and strong. Let's jump into and learn how my mom and I decided on my treatment plan. Here's my spine before treatment. The x-ray on the left is from when I was 3 years old. The x-ray on the right is immediately right after my first cast was applied. Those results were pretty incredible, right? Here are some of the photos on my casting journey. For 19 months, I would make 6 trips to the OR every 8 weeks or so to have a new cast applied. One thing you should know about casting is you could still do most things other than getting wet. I'm thankful because my mom refused to let me use my diagnosis as a crutch. She forced me to try new things. While I was in a cast, I learned to play soccer and ice skate. After my casting journey was over, I started bracing and Schroth therapy. My experience with bracing was good for the most part. I was now able to swim and shower daily. I tried 3 different types of back braces through the years, with the Rico Chanel brace one the longest. As I became more active, it was difficult to wear my brace 22 hours a day. I share this because wearing your brace is important. I was in a back brace from kindergarten until the end of 5th grade. Here are some photos of my bracing journey. The coolest part of this journey was I got to help make my braces and use a blowtorch. The next part of my journey involves surgery. Just 2 weeks before my checkup, I competed in a national tournament for field hockey called NITs. My team and I played in a top bracket against teams from all over the country, and we walked away with the first place medal. I had 0 pain, and I thought I was doing great. Imagine my surprise when Dr. Shah discussed my surgery options. At first, I was sort of upset with him, but then I became scared and nervous. I didn't understand why I needed surgery. I was sad I was going to miss out on sports. If I'm being completely honest, I was afraid I'd lose my spot on my sports teams. This was the hardest part for me. The image on the left is my spine from pre-op visit 1 week before my surgery. My largest curve was 59 degrees. This is almost identical to where my journey began in 2013. The image on the right is my spine after surgery. My curve measured just 19 degrees. That's a 40-degree correction. After surgery, I spent 2 days in the hospital. The best part was the unlimited blue slushies from the nurses and all the Squishmallows I received from my friends. Squishmallows are life after surgery. Seriously, they keep you comfortable while your body is getting used to your new spine position. I was out of bed the next morning and moving around. I was off all pain meds by day 5 and used Tylenol as needed. I returned to school around 2 weeks after my surgery. As of today, I'm now 14 months and 2 days post VBT surgery. I feel awesome. Here are some photos of what my recovery looked like. I was able to make a return to all of my activities. My recovery was more mental than physical. While PT isn't necessary after surgery, for me it was. I started PT around 3 to 4 weeks post-op. The goals I wanted to achieve were returning to sports and riding a roller coaster again. I accomplished everything by the end of summer. I also was able to tell my story, which is important to me. I was able to share my journey during my hospital's research week with researchers, scientists, and other surgeons this past fall. In these photos on the bottom left, I returned to field hockey and competed in a college showcase 5 weeks after surgery. You heard that right? 5 weeks after surgery, I was cleared to compete. I even tried something new to me. I went skiing for the first time last winter. My mom was so nervous, I think she secretly hoped Dr. Shaw would say no. I'll also fill you in on a little secret. When you have spine surgery, you celebrate your spine anniversary. It's like a birthday party, but for your spine. In these photos, you guessed it, more PT. Honestly, I went to PT for 9 months because I enjoyed it. When I wasn't at therapy or practice, I would go to the gym to get stronger. I attended my first ever school dance. I also went deep sea fishing and caught this fish. I realized I've lived with scoliosis almost my entire life. So I'm pretty sure that makes me an expert on treatment options. In this slide, I've rated my treatments through the years from my least favorite to my most favorite. I realize I'm pretty lucky I had the option to choose between 2 surgeries. Some kids only get one option. My scars almost disappeared, but they never bothered me. I'm proud of them. My curve now just measures 7 degrees. I've grown just about 3 inches, and my hardware is still in place. The best advice I could give anyone in my situation is to find a surgeon you feel good about. Don't be afraid to advocate for yourself. Talk to your parents, though your thoughts matter. Remain calm and be a warrior, not a worrier. And after all is said and done, share your story and advocate for others. They will need your strength to get them through. Thank you for listening, and I appreciate you guys letting me share my story.
Wow, Piper. That was fantastic. That was even better than the talk you gave at the experimental station. It was really inspiring. We have a question in the, at least one of the questions in the Q&A about elaborating the main differences between tethering and spinal fusion. And obviously, that's at the forefront of a lot of our scientific meetings as well. In a nutshell, I would say that tethering offers a possible benefit of retaining motion of the spine over time, but at an increased complication rate. We clearly know that probably 20 to 30% of patients with tethers might require another surgery. The tethers frequently break at 18 to 24 months post-operatively, but by that time, they're probably not functioning in the way we need them to function like we did in Piper's first year. Spinal fusion surgery is extremely successful. You heard about that from a couple of our patients. It's a more traditional method. There's much more evidence available on those methods, and the complication rate, I would say, is much lower. But in the interest of trying to evolve and trying to innovate, different treatments will come up during our careers. What we're supposed to do, though, as scientists and investigators, is figure out which of these treatment options are the most safe and the most applicable for each patient. It's not a one-size-fits-all, as you might have in clothing, for instance, but we really try to customize the treatment with the patient. And Piper's mom, Tracy, will know that we spent a lot of hours discussing the various options, and she's a very intelligent woman that went outside our discussions and did the evidence on her own and came to the best decision for her child. Suzanne is back with another question about, is spine maturity related? I guess that's in reference to tethering, and at least Dr. Fletcher and many of the surgeons in our organization feel that vertebral body tethering is most applicable for people who have remaining growth. So especially those teenagers who are in their peak height velocity seem to be the best candidates for tether. And we assess that potential with hand x-rays and other maturity assessments. For those people who are done growing, tethering doesn't seem to be as successful as a spinal fusion surgery might be. Nick, would you have anything to add?
No, I agree with everything. I think that probably the most important point is that even though there are different treatment options out there for scoliosis, needs to be a wide open conversation with your surgeon, and the surgeon needs to be well versed in both treatments, or if there are other treatments that you're looking at as well, and so that you can understand the data to support it, and that you can be as well informed as possible. But I think that Dr. Shah and I both feel similar in terms of our typical indications for both vertebral body tethering and spinal fusion. And at the end of the day, the indications for spinal fusion typically are going to come about much more commonly than tethering. I think it's a relatively select group of patients who fall into that category.
Excellent. Now we'd like to introduce Michelle Marks, who's the Executive Director of the Setting Scoliosis Straight Foundation. Michelle.
Thank you. Thank you, Dr. Shah. Thank you, Dr. Fletcher. We really want to comment on how wonderful this patient-to-patient webinar was. We heard so many incredible stories of strength and hope and encouragement, and really making a difference and paying it forward from these incredible patients who have experienced scoliosis and have gone through treatment. We hope you found this very helpful, and we'd really love to share our You Are Not Alone initiative with you so you can see ways that you can get involved. Like many species, people are herd animals. This herd instinct relates to the benefits of safety in numbers, social connection, and sharing knowledge and resources. These three benefits are the backbone, pun intended there, to the Setting Scoliosis Straight You Are Not Alone initiative. Safety is supplied by minimizing fear and providing evidence-based information to patients with scoliosis. Social is offered by identifying others like you who are facing the same struggles. And sharing is delivered by patient experience and knowledge, along with incredible tips and tricks. Setting Scoliosis Straight is partnering with patients to fulfill our You Are Not Alone initiative. If you would like to get involved, please contact us and we will get you started in this program. So in June, scoliosis awareness, as Dr. Shah mentioned, we did run a scoliosis awareness campaign, and we are very, very close to our goal of 3,000. So if you felt you benefited from this webinar today and would like to help out, you can scan the QR code or text Scoliosis Strong to 71777. Next slide. Also, in honor of June Scoliosis Awareness, we held a t-shirt contest, and it was a design contest, and we had amazing submissions and many, many votes for all of the different front runners. And the winner is, next slide, Sydney Borchardt from Oklahoma City made this amazing, beautiful t-shirt design for to celebrate scoliosis awareness in honor of June. Sydney's going to win a t-shirt with her design on it, as well as an SSS t-shirt. And you, next slide, can also get a t-shirt like this from our Spreadshirt shop. Just scan the QR code or visit our Spreadshirt store. You can get there from our website. Thanks. Next slide.
I think Ava wants that design for a brace too.
Really? Oh, very cool.
It is a very cool design.
Oh, there you go. All right. Well, we're really excited and proud that we are releasing the revision, which is the 4th edition of our patient education handbook today. It is now available live on our website in PDF format. We've really added a lot of incredible content regarding bracing information, vertebral body tethering, which there were a lot of questions about that today. So please download this free patient education handbook from our website and be one of the first to have this new revised version. You can scan the QR code there. Thank you to all the contributors for that, their input on that handbook. It was a feat. Next slide. And if you felt you benefited from this webinar, there's also other opportunities for education through our SSS YouTube channel. Please visit it, and you can see all of our recordings there. Next slide. Also, we have 3 more webinars coming in 2023. The ending one will be on VBT compared to posterior fusion. So if there is interest in that, please register for those. And there's more information on our website on all our upcoming webinars. Next slide. Okay, and lastly, we can't do what we do without your support, and we also can't do what we do better unless we know what we need to do better. So please give us feedback on these webinars and fill out the survey. But thank you to all of these incredible patient speakers today. We couldn't do our You Are Not Alone initiative without you, which are patients. So thanks for today. Thank you, Dr. Fletcher. Thank you, Dr. Shah, and take care.